Despite the numerous setbacks and the gnawing frustration, Aris Thorne pressed on. His laboratory, once a place of quiet contemplation, now hummed with renewed purpose. He had spent countless hours poring over scientific journals, seeking inspiration from unexpected fields. One evening, while reviewing a paper on advanced polymer chemistry, a seemingly innocuous footnote caught his eye. It detailed a novel hydrogel, initially developed for drug delivery, with an unprecedented combination of flexibility, transparency, and biocompatibility. A spark ignited in Aris's mind. Could this be the material he needed for the lens itself? More importantly, could it serve as a stable matrix for his delicate biosensors? He immediately ordered samples, his heart pounding with a mixture of hope and trepidation. The arrival of the hydrogel marked a turning point. Aris began meticulously embedding his enzyme-based glucose sensors within its structure. The hydrogel proved to be a revelation. It protected the enzymes from degradation, maintaining their activity for extended periods. The readings were more stable, more consistent than anything he had achieved before. This breakthrough, however, presented a new challenge. Power. The miniaturized sensors, while efficient, still required a continuous, albeit tiny, energy supply. Traditional batteries were far too bulky, and external power sources were impractical. He needed something revolutionary, something that could be integrated seamlessly. Aris remembered a concept he'd once dismissed as science fiction: biofuel cells that could generate electricity from the body's own fluids. Specifically, he focused on tears, a readily available and constantly replenished resource. He delved into the complex biochemistry of tear fluid, identifying specific enzymes that could catalyze reactions to produce minute electrical currents. It was an audacious idea, fraught with technical difficulties. He spent weeks in a specialized cleanroom, working with nanoscale electrodes and enzyme coatings. The initial prototypes were frustratingly inefficient, barely generating enough power to flicker an LED. But Aris, fueled by his sister's memory, refused to yield. He refined the electrode design, optimizing the surface area for maximum enzymatic activity. He experimented with different enzyme concentrations, searching for the perfect balance. Slowly, painstakingly, the power output began to climb. One late night, after countless iterations, he witnessed a small, steady glow. A tiny LED, embedded in a prototype lens, remained illuminated for hours. It was a moment of profound triumph, a silent testament to years of struggle. He had successfully created a self-sustaining power source for his smart contact lens. The biofuel cell, powered by the wearer's own tears, was a marvel of miniaturization. It was stable, non-toxic, and most importantly, completely imperceptible to the wearer. This dual breakthrough, the stable hydrogel sensor matrix and the tear-powered microbattery, transformed his vision from a distant dream into a tangible reality. He held the prototype lens in his hand, a delicate, almost invisible disc. It contained the promise of a future free from the constant burden of diabetes management. The intricate network of sensors and the tiny power source were now seamlessly integrated. They were ready for the next crucial step: rigorous testing. Aris felt a surge of exhilaration, tempered by the immense responsibility he carried. He knew the path ahead would still be challenging, but the most formidable barriers had fallen. The memory of his sister, once a source of sorrow, now fueled his unwavering determination. He imagined a world where no one else would suffer as she had. A world where a simple, comfortable contact lens could provide continuous, life-saving data. The lab, once a place of solitary struggle, now felt like the cusp of a revolution. He carefully placed the prototype back into its sterile casing. The faint hum of the equipment seemed to echo his own anticipation. The next phase of development, human trials, loomed large, but for now, Aris allowed himself a rare moment of quiet satisfaction. He had turned an impossible dream into a scientific marvel. The smart contact lens was no longer just an idea. It was a delicate, powerful piece of engineering. It was a beacon of hope for millions, and it was ready to change the world. His journey, though far from over, had reached a pivotal, triumphant milestone. After countless setbacks and the gnawing despair of near failures, a new dawn broke for Aris. A serendipitous discovery in nano-coating technology, combined with a novel, non-invasive electrochemical sensor, ignited a spark of hope within him. He felt a surge of renewed purpose. Hours blurred into days, as he meticulously integrated these advancements into his design. The cluttered lab, once a testament to frustration, now hummed with the quiet intensity of imminent success. Every wire, every circuit, every microscopic layer was placed with deliberate care and precision. He worked tirelessly, driven by the memory of his sister and the promise of a better future. Finally, after what felt like an eternity of relentless effort and countless revisions, Eris held it in his hand, the Glucolens. It was a moment of profound triumph. These were not the bulky, futuristic contraptions of his early imaginings, nor were they cumbersome. Instead, they were transparent lenses, almost indistinguishable from regular contacts, yet brimming with miniature marvels of engineering and medical science. They continuously sampled tear fluid, a silent sentinel monitoring the body's delicate balance of glucose. This constant, unobtrusive vigilance was a cornerstone of his vision. The real-time glucose data was then transmitted seamlessly and securely to a discreet smartphone app, a digital guardian providing constant vigilance without intrusion into daily life. The next hurdle was the daunting process of clinical trials. Initially, the medical community met his invention with skepticism, their faces etched with doubt. Accustomed to the limitations and failures of existing diabetes management solutions, Eris, however, presented his findings with quiet confidence, fueled by the enduring memory of his sister. He believed in the Glucolens with every fiber of his being, and soon, the data spoke for itself. The trials yielded astonishing results, surpassing even Eris's most optimistic projections and hopes. Patients, who had endured years of painful finger pricks and bulky wearable devices, reported unprecedented freedom and a profound sense of peace of mind they hadn't known before. No longer were they tethered to constant monitoring rituals. Their lives were truly their own again. They could live spontaneously, without the constant worry of their condition. One patient, a young artist, much like Eris's sister, wept tears of joy during her testimony, describing how the Glucolens had given her back the spontaneity she thought she'd lost forever. She could paint for hours, uninterrupted, her creativity unburdened. The device not only detected dangerous fluctuations in glucose levels with remarkable accuracy, but also possessed an uncanny ability to predict potential hypoglycemic or hyperglycemic events before they became critical. This predictive power was revolutionary. This foresight allowed for proactive intervention, preventing emergencies and significantly improving overall health outcomes. It was a paradigm shift in diabetes care, moving from reactive to preventative. Eris, once a solitary figure lost in the labyrinth of his research, found himself hailed as a visionary. His invention, born from personal grief and relentless dedication, was offering a new lease on life for millions. He had fulfilled his silent promise to his sister, transforming the landscape of diabetes care forever. The Glucolens was more than just a medical device. It was a beacon of hope for countless individuals, a testament to the power of innovation driven by compassion, and a legacy that would endure through generations. Its impact resonated globally, changing lives one contact lens at a time. The initial skepticism of the medical community had transformed into widespread acceptance and admiration. Doctors and researchers lauded the Glucolens as a monumental leap forward, a true game-changer in the ongoing battle against diabetes. Pharmaceutical companies, initially wary, now sought partnerships, eager to integrate the technology. Eris, despite the accolades, remained grounded, his focus always on the patients. He often spoke at conferences, sharing his journey, his voice filled with humility and gratitude. Each success story, each patient's testimony, reaffirmed his purpose and dedication. The Glucolens became a symbol of what dedication, fueled by a personal mission, could achieve. It wasn't just about technology, it was about restoring dignity and freedom. The future of diabetes management had arrived, and it was clear, comfortable, and constant. Eris ensured that the Glucolens remained accessible, working to keep costs down. He established foundations to provide the device to those who couldn't afford it. His sister's memory continued to inspire him, guiding his philanthropic endeavors. The world had changed for diabetics, and Eris was at the heart of that transformation. His invention had not only saved lives, but had also given back the joy of living. The Glucolens, a tiny marvel, had created a ripple effect of profound positive change. It stood as a monument to innovation, compassion, and the enduring human spirit. Aris had not just invented a device, he had ignited a revolution. His legacy was etched in the newfound freedom of millions. The world looked different now, clearer, through the lens of hope. And Aris, the quiet inventor, had finally found his peace.